people have heard of OCD or obsessive compulsive disorders? Many people have, but not many people have heard of their treatments. As a psychology student and someone who has been studying psychology since I was in high school, I have learned different disorders and their treatments. And one of the best treatments for OCD and other compulsive disorders is CBT or cognitive behavioral therapy. Cognitive behavioral therapy is useful in controlling intrusive thoughts and treating compulsive behaviors by first addressing the cause and symptoms, creating a plan for challenging those thoughts and symptoms, and finally dismissing and controlling the behaviors. So what is cognitive behavioral therapy? Well, CBT is a subsection of psychotherapy or talk therapy that focuses on introspective thinking, and it teaches the patient how to challenge and control their own thoughts, emotions, and behaviors. The first step in reaching that goal is to address the cause and the symptoms. A study was conducted by the Psychiatric Clinic of North America and was titled Cognitive Behavioral Therapy for Obsessive Compulsive Disorders. The study focused on illustrating how CBT can help obsessive compulsive disorder by recognizing where these compulsions come from and how to treat them. Once you recognize where these compulsions come from, you're able to understand that these compulsions are not your fault. They are not of yourself. They come from stimuli or triggers that can develop at youth or through adulthood through different situations. So once the patient recognizes that this is not their fault, these thoughts are not their fault, they're then able to control them and to create distance from those thoughts, which helps them to mitigate these behaviors. So the first step in challenging these behaviors is going to be using compulsive behavior rituals as outlined in the textbook, the psychology book, titled by Big Simply Explained. In this book, there's a flow chart that illustrates how to complete this ritual. So this is a ritual that's going to stick into the patient's head. So when they feel these thoughts come on or these behaviors come on, they start to use this ritual. So it starts with understanding where these intrusive thoughts are coming from. To first say, hey, this thought is a little crazy. This must be an intrusive thought. You're understanding that this is over important and it is obsession. So once you're understanding that, then you can recognize whether or not this thought is a threat or whether it is a behavior that's a threat. Once you recognize that, then you understand that this is something that I am responsible for. So once the patient recognizes that this is something that they are responsible for, they can then come to the conclusion that they need to do something about it. They are more compelled to take action once they recognize that this is something that they can do something about, that they are then responsible for. So once the patient is able to do that, then they're going to go to the next step, which is exposure therapy or habit ritual forming. So these are subsets of CBT that are used to expose the patient to their own thinking and to help them dismiss the thoughts that they do have. A study and article written by the Anxiety and Depression Association of America titled Treatments for OCD outlines two different treatments for OCD through cognitive therapy. One being exposure therapy that focuses on exposing the patient to triggers. Once the patient is exposed to triggers, they can then put themselves in this situation in real life and use the tools that they're learned by the clinician and use this ritual, put it into action, basically. So if, for example, a patient has high stress situations and that can be a trigger for them, for example, being in traffic, you can use simulators or online VR situations that can allow the patient to get exposure, and then the clinician would encourage the patient to dismiss these thoughts. So once the patient is in that situation where they feel stress, the clinician can help them through it. Another way is through habit ritual forming, which is another part of this therapy. These are de-stressing habits. So soft breathing, thoughts that are patient with yourself and positive. These thoughts can help a patient when they come into those stressful triggers. They can use these thoughts, they can use these habit rituals and dispel the thoughts and behaviors. So we all have intrusive thoughts, and OCD is not the only disorder where CBT can be effective. It can also be effective for everyday individuals who have intrusive thoughts. And it can benefit them by giving them the ability to control and introspectively think on their own thoughts and behaviors. So whether it's through psychology, weekly therapy sessions, or through a textbook and a patient is doing their own studies, they can figure out how to control their own thoughts